One of the most valuable things you can do for your practice when it comes to schedule management isn't so much about putting an appointment in the exact right spot, but rather it's in setting the tone that appointments at our office are important and valuable. We tend to create the idea when we make appointments for patients, especially when they're 6 months out, that this is somehow tentative. We'll even say things like, if this doesn't work, just let us know, which sort of sets the tone at that time that, like, if this doesn't feel convenient when it rolls around, you just cancel on us. And as a result, we have tons of cancellations in our schedules. It's a huge, huge amount of time and energy that goes to filling in those openings short notice to keep our schedule held together, despite all the work that went into getting it there to begin with. So if you can adopt the idea that you are the protector of your schedule and that these appointments are important, you can take the stance of setting that expectation with patients a little bit differently. And the best way to do that is to create commitment by asking for it. And to some people, this feels really forward. And when I say this, I actually watch them like gasp. But here's actually what I actually say every time I schedule an appointment to this day. I set the expectation for where and when and how long. So, okay, Mary, I've got you scheduled next Wednesday at 9 a.m. with Dr. Smith. I'm going to have you here about 90 minutes, right? That seems normal. We all do that. What I do at the end of that is I actually ask her to commit to that appointment. And not so forward as I want to say, can you swear in blood that you'll be at this appointment? Obviously, that would be very weird. But I do say something that sounds like, Mary, I really need a couple days notice if you need to move this appointment. Can you just promise you'll call me if anything changes in your schedule? And then I wait an awkward 1 second while she processes what I'm saying. And you'll see if you do this in person, people actually kind of nod to take it in. Sometimes people aren't listening to us at this point. They're kind of trying to get out of the dental office. They're ready to go. And they'll actually say to you, what? Which just means this is our opportunity to create clarity around how important this appointment is. So I'll just say it again. Oh, I'm just saying I really need a couple days notice if you need to move this appointment. Can you just promise you'll call me if anything changes? To which most people say, absolutely, yes, I've got it in my schedule, and that's what I'm looking for. The difference between asking a person to promise to call me is very different than saying, and our office requires 48 hours notice. As I've mentioned, they're not really listening to us at this point, and also they don't care what our office requires. But what they do care about is me really needing notice and the promise that she just made me that she'll give me a call. If the word promise is too much for you to take, and I recognize for some people that feels a bit forward, one, I would challenge you a little bit and say, have you connected with this patient enough? Because if you've connected with somebody, if you have rapport with them, that shouldn't feel like that weird of a word to you. But if it does, you can just say something that sounds like, I really need a couple days notice if you need to move this appointment. Can you please be sure to let me know if anything changes in your schedule? The important thing is setting it up as a question that they have to process that information and then verbally commit to. Because when people verbally commit to something they said they would do, they feel compelled to do it. And it's so much more effective than threatening a cancellation charge or informing them of your policy. And if you can build the habit of creating importance and commitment around the appointments you're scheduling, setting the tone for patients that this time is hard to come by and we really need notice if they have to move that appointment, if you can reduce your cancellations by 10% with this single effort, you are going to save yourself so much work and scramble, and you're going to build better relationships that are higher quality with your patients.